Hello, everyone, and welcome. My name is Dr. Ngozi Onoha. I'm a physician and health educator. Welcome to Health for Naija podcast. Here we talk about health, we share information, and we share inspiration. Today, I have an incredible guest. Her name is Dr. Chamoun. She is a double-boarded cardiologist, a lifestyle medicine physician, a certified health and wellness coach, and a wellness podcaster from the main line of Philadelphia. She is the founder and president of CardioSeeds, a company that coaches physicians who have burnt out and need a career pivot. Welcome, Dr. Chamoun.
Thank you so much, Dr. Naha. It's my pleasure to be here tonight.
I'm so happy to have you here.
Thank you.
So tell me, Dr. Chamoun, you've been a cardiologist for more than 20 years. So why did you decide to go into lifestyle medicine and start your own company?
You know, Dr. Naha, we know each other for more than 20 years, right?
Absolutely.
It's been fun, right? It's been a long journey.
It has.
And you probably also can feel that medicine has been changing. We are changing and medicine changing. And my perception of myself and perception of medicine in the United States also is changing within me. So, you know, when I went to medicine in Ukraine, and I'm from Ukraine, you know that.
Yes.
We did not make that much money in Ukraine in medicine. So I went there when I was 17 years old, and I went there for a sheer, need from my heart to help people. And when I came here and retrained, I realized that medicine was a little bit different here. And when I was a trainee, and it's a long story, of course, I would like to make it short. When I was a trainee, I kind of got caught in this mill, you can relate to that probably, that was probably coming from the 60s, when this medicine became something more of a tough competition between the doctors for like smartness and endurance, you know what I mean?
Yes.
So that kind of empathic side of us, we could not show empathy, we could not show, internal kind of weaknesses. It was not something that was cool. So it was not cool to be vulnerable. It was not cool to be, caring, empathic. It was cool to be tough, to be working very long hours. And also, as long as I was going, the longer I was going through this profession, almost 20 years, I was looking at the numbers that our medicine here in the United States was actually achieving. And I was realizing the more we were getting exhausted as physicians, the worse the numbers were. Our patients were getting actually sicker, and the diabetes and obesity, and everyone was, going to get an obese, and diabetes was shooting through the roof. So something was wrong. We were not getting anywhere, right? As hard as we worked. And also the GDP part, or the numbers that we were spending on medical care, was just atrocious. So something we were doing it wrong. And at that moment, I started thinking, as a physician, where am I? What am I doing? Where is my real place? So am I really contributing to the health of the population? Am I contributing to my own well-being, to my soul? Where is my soul? Where am I? And am I helping? Am I really helping? And at that moment, coincidentally, I discovered the lifestyle medicine for myself. I discovered this organization called the American College of Lifestyle Medicine. That was in 19, before the pandemic. I joined them, I got board certified. So this is kind of the organization of like-minded people who want to do the right thing, essentially, to do the preventive medicine, want to practice preventive medicine, eradicating the root cause of diseases, essentially, because 85% of all chronic diseases patients experience here in the United States, they actually come from, wrong or I should say deficient lifestyles, right? Like smoking, poor eating habits, et cetera, et cetera, et cetera. So we are addressing those things. And I said, I can benefit people much better if I pivot to something that I do from my heart and from my soul, and that I was actually born to do, instead of continue this rat race, essentially. So that's the short story of that.
Yeah, I mean, you've come a long way, definitely. And even medicine has come a long way. If we
Yes.
look at medicine of the 60s and now, so many advances, a lot more we can do for patients. And not just that, when you look at the food chain as well, that has also changed the way we source our food. There are more foods that are manufactured, genetically modified foods as well. So when you look
Absolutely.
at the way we eat generally, I think we become more sedentary, right?
Absolutely.
Um,
I think I will let you continue. I will let you finish, and then I want to, continue your thoughts from my perspective as a lifestyle medicine physician. I want to hear your perspective on this as well.
well, I just believe there's been so much change from the 60s. We're talking about when the hospitals started getting organized in Europe and in Africa. Of course, America's health system started well before then, so they were far ahead. But I think that we have to adapt and adjust.
But what do you
So,
think is changing things as much as we are observing? What is the driving force? The driving force, in my opinion, of all things that we observe is people with deep pockets, right? So essentially, our patients and we as physicians, we became a small parts, small pieces in the game and the puzzle of people with big money. Of big money, essentially, right? So whether
well,
it's pharmaceutical, big pharma, right, or hedge funds that buy hospitals or medical care
right.
systems, right? And then I don't say it's necessarily a very bad thing because they know how to run them financially, but those things only become beneficial to the consumers when benefits trickle down all the way down to the consumers, right?
Yes.
But during COVID-19 pandemic, we observed that those private institutions were not necessarily great or the best thing ever, because we knew that they cut corners with, for instance, storing supplies or storing masks or ventilators, right? Because for them, shelving something for a long haul, is not beneficial. It's like throwing money in the window, right?
Yes.
Keeping those surplus of ventilators, for instance, right? And the hospitals are getting privatized by hedge funds or private equities, and more and more and more. Now it's like, what, 60% or 80% of hospitals are all in private hands of hedge funds and private equities. Back in the day, there were hospitals that belonged to the cities, right? The hospitals that were affiliated with churches, with cities, with those institutions, religious institutions, and they were like charitable and did all this treatment for free, right?
That is so
Now,
true.
right now, however, is what we became instruments, both patients and doctors alike, instruments for people who want to make big bucks. essentially.
Right.
So what happened was this, in my opinion, what happened was this. They squeezed doctors into a productivity system. They invented the productivity system for us, right? Because we are weak in a way. We cannot stand for ourselves. We became fragmented, fractured. We are not unionized, God forbid. Oh gosh, we can be in a union. So we don't have strong representation, let's say in Congress and whatever, right? So, and those guys do, who have big money. So what happens is they put us on productivity system, because what they need us to order more, procedures, more tests to make more money, right? To sell more drugs. Forget about prevention, right? If I, for instance, I, as a lifestyle medicine physician, backed by years of research and hundreds of papers, strong academic research tell you, for instance, that nutrition is equal to many diabetic drugs, they will throw me out of the window, right? Because they cannot make money on nutrition as much as they can make money on very, very powerful and expensive diabetic drugs, or stents, or cardiac procedures, etc., etc. So all of this is what costs money. So, and then physicians are forced to see patients every 15 minutes. Why? Because there are more patients to see, right? More money to make for shareholders. So where we are, we're in a rat race, essentially.
So let me stop you here.
I don't want to paint a horrible picture here because there is, of course, hope. But
Yes.
this is why patients that aren't getting better. So we have to go back to the roots and start everything from prevention. Go back to square one, essentially, to save the patient, save the system.
Yeah, I listened to one of your podcasts actually where you did talk about this, how diabetes can disappear with the right lifestyle, diet, exercise. And it was very, very interesting.
And
But
it's not an invention of my mind.
yes,
It's
yes.
a science. It's pure science.
Yeah, and I've seen it happen. But it takes a lot of discipline. It's not so easy to say you're not going to eat sugary things. And I think, again, the kind of lifestyle people have in America, some work 2 jobs. They get home, they're tired. Some work the night shift. So
Right.
there's no way to incorporate healthy lifestyle into, these ideas are absolutely wonderful and they work. But in reality, number one, when the food is so rich, the portions are so huge, and people just don't have the time to go to the gym, or they don't have access to gym. So how do you incorporate that into
Right.
lifestyle medicine?
Oh, this is such a perfect question. I hate this when people say this is such a perfect question. And I'm going to say it because this is such a perfect question.
Thank
You
you.
know, this is what we as lifestyle medicine physicians actually study for our boards and practice in our practices, because nobody else approaches this from the perspective of what we call 6 pillars of lifestyle medicine and behavioral coaching incorporated in all of the practice of lifestyle medicine. So this is why this is all multifactorial, and each patient is different from the other. And everyone has to have an individual approach. So what's good for me may not be good for you. And when we meet, we need to assess the factors that surround you individually and make sure that not only you are ready for a change, right? But the fact that you have, the environment, the milieu, the support system that will take you there. And then we create what we call SMART goals. SMART is abbreviation that, the measurable, accountable at such and such time, timetable, etc. You know, probably
Yeah,
all the
specific,
specific,
yeah,
right? So
measurable. Yeah.
we actually
Yeah.
write lifestyle prescriptions to patients,
Mhm.
but we don't do this just to say, eat more vegetables, eat more fruits, because we know, for instance, that certain areas of Philadelphia, huge areas of Philadelphia, West Philadelphia, North Philadelphia, right? They right on the border, by the way, with the main line where I live, right on the border, the Lincoln Hospital gets a huge population, for instance, from the West Philadelphia, who may have food stamps, for instance, right? Such a constant, such difference. Family of four gets $680 during the months, monthly in food stamps. So what is it? Leaves you with $170 per week. So go and try to feed a family of four for on $170 per week. But it's possible. It's possible if you do planning, if you know where to shop, what to cook, and what techniques to use. You don't, by the way, you save money, but by making food at home. This is why we have, registered dietitians who can help. We have people like me who have base background in learning dietetics, and health and wellness coaching. We have enormous resources that we can offer, and we know how to shop, how to prepare food, and how to spend this $170 shopping in certain places, shopping in certain aisles, and using certain techniques to prepare actually healthy foods and store them, how to freeze them, how to store them for a week to benefit the whole family. And about exercise, actually, it's a good one, because my husband is a practicing physician at the hospital that borders Philadelphia and the main line, and he says patients come to him all the time, and they say, we live in an unsafe neighborhood. We cannot walk outside. And he says, there are videos online, right? You can do floor exercises with your body weight, and you actually only need 10 minutes at a time, twice a day. You don't need to do 30 minutes every day. You can do 10 minutes and 10 minutes. And if you do 10 minutes grouped together, and another 10 minutes, maybe 3-4 hours later, that's plenty. As long as you do it, regularly. And you don't even need to leave your apartment. Just do it on the floor. You can do it on your chair, literally speaking, or if you immobile, you can do just upper body exercise. Yeah.
Those are really good pearls that you've just shared. Basically,
motivation is very important. Yeah. Yes. This is why, coaching comes very important in this.
Motivation and knowing how to shop and how to prepare the food. That's important. So let's go on to your my next question for you. So it's about your work coaching physicians about burnout management. I just listened to episode 17 of your podcast, CardioSeeds, where you talk about burnout and the factors that create burnout. It's a very complex topic. And so how do you help physicians in this role? I mean, do you just work with physicians? Because I know burnout is not just unique to physicians. There are also certain professions, not necessarily medical. And just for the benefit of the audience, I know there will be lots of people listening to this podcast, and not all of them are in the medical field. Definitely, we know that other professions do also suffer from burnout. Even in the legal profession, lawyers suffer from burnout. So anybody who's doing work where I guess they're not appreciated, or maybe they work unreasonable hours, or there's extreme stress, lack of support. So all the factors that you mentioned contributing to burnout. So not just physicians. So I know you work just with the physician population, right? So,
At this
mhm,
point, right, Dr.
mhm,
Noha, thank
mhm,
you very much, by the way, for
mhm,
listening to the podcast.
mhm,
It's important for me to get this message out.
mhm,
You know, I started CardioSeeds as a mainstream lifestyle cardiology practice, but several months ago, my husband and I were at this function at the gathering of physicians, essentially, and several people came to me, several doctors, colleagues came to me, and they said, would you consider pivoting the practice to do physician burnout? You
mhm,
know, and there were several of them, more than one, more than two.
mhm,
And they came to me independently during this
mhm,
2-3 hours of me being there.
mhm,
And the more I looked into this, and the more I was reading and attending conferences on burnout, like
mhm,
there are huge seminars, there are huge symposia. I was
mhm,
unaware that people are so involved in this.
mhm,
And then the more I was reading, it turns to be, Dr. Noha, that one physician per day dies in the United States
mhm,
to suicide. You know,
mhm,
the rate is 3 times higher than in any other profession,
mhm.
including police and including the military. I was shocked. I was shocked. This is how
Yeah.
not only how stressed out we are,
Mhm.
but also how much unprepared we are to face the stress.
Yes, I think the system doesn't have a good, should I say, safety net for
Yeah,
its physicians.
yeah,
The
you see,
systems overall don't have a good safety net for its physicians, to
right,
be honest
right.
with you, because if a physician is facing burnout in an institution, they really don't have anybody to call. You can't call HR. You
Right.
can't
Well,
call your supervisor, and you
they
can't
have
call
those
the,
lines. They have
you know.
those lines supposedly anonymous,
Mhm.
right? But sometimes it trickles out, and God
Right,
forbid, a mental problem gets out to the board, right? The medical
right.
board, and then it becomes a problem. Do you know the fact that all of us, you know, each of us renew our licenses on a biannual basis every other year.
Mhm,
So we have to fill out that questionnaire, right?
mhm,
Whether we have any mental problems, a mental history of mental problems.
mhm,
And that history of mental problems becomes a problem by itself, that question, for
mhm,
many physicians who may had even history many, many years ago
mhm,
and were treated and were cured. Can you believe how unfair it is? Because that question per se triggers the necessity to answer more questions and do explaining on that very form, and they
mhm,
start investigating you those boards.
mhm,
Even if you had like some innocent, I was reading into this, you know, I was
mhm,
investigating the situation. Some people had lawsuits with their medical boards of their
mhm,
states and won, because medical boards were prying essentially into their private life and getting access to their, you know, private medical records from 20 years ago. So
mhm.
what I was thinking, you know, burnout for physicians is multifactorial,
Right.
obviously. So it can be a physician factor, you know, something going on with their families, something going on with health, or it can, and also systemic, obviously. System, too much work, right? Too much work. Every 15 minutes, as I said, a patient comes in. Next, just too much work. Then regulations, of course, we have to do CMEs all the time, or some sort of courses, you know, some sort of, you know, passing all of those things, you know, for physicians, like either safety, right? Safety questionnaires, all they send it to you all the time. You have to pass something all the time, right? And if you don't pass it, the 5%, they just
Well,
cancel you. You
I,
don't
I know
exist.
the
You
whole
don't exist anymore.
pandemic, I
Right.
spent it preparing for my
I'm
recertification,
sure.
so I totally
It's
understand
a
what you're
nightmare. My
saying.
husband is constantly studying
You
something,
know?
constantly answering some questions online. And he said, "Damn, I hate the day I was born." But also, it's not only that. Some physicians, some hospital lack elementary safety, right? The patient can come with a gun and just start shooting, number one. Number two, EMR. EMR is a nightmare of nightmares. Some physicians do clerical work because they don't have clerical support. And EMR can be, not only unfriendly, it can be just, they may introduce like, so what they call upgrades, and it may just change or erase prior records, and physicians are struggling with, just spending time and taking work home, despite the fact that they already put 12, 13 hours, at work. They have to come home.
Yeah,
It's not funny though, and
yeah.
and continue working
I
for
know
another 5 hours.
yeah, I know EMR is a burden, but there were some recent rules that kind of reduced some of the
Maybe, right.
documentation requirements a
Maybe,
little bit.
maybe somewhere,
So they are addressing some of
they
these
are addressing.
issues.
But also, I looked most recently, there was this Journal of Medical Economics published the third annual, burnout questionnaire review. So they ask physicians, anonymous supposedly, they ask physicians, how many of you are experiencing burnout at this very moment? 80%, whopping 80%. And the perceived burnout rate was 6.8 out of 10. High self-perceived burnout rate. So, and people said that, and then some scientists looked at the burnout prevention program or burnout resolution program, whatever they are, at workplace, and they mainly address burnout when it already exists. It does not, they don't prevent burnout, or they address them, from kind of a wrong standpoint. They kind of almost like blaming a victim. You know what I mean?
Yes.
Blaming the victim. So they don't provide physician with comfortable, environment, nurturing environment for them to work, enough time for documentation, enough time to even see patient. Hey, what about giving them 20 minutes, 25 minutes? No, 10 minutes, bang, 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 No, let's treat them for burnout. Let's give them 10 minutes per patient and then try to treat them for burnout. Yeah. Sometimes people don't have windows in their offices. Cafeteria food may be horrible without any healthy choices. I don't even mention that. And the support team may be close to non-existent or pretty lousy, untrained or poorly trained, right? So, voila.
Okay, so we talked about your work coaching physicians about burnout management. I think when I took an MBA, in that MBA, I learned that executives who, they go through stress and they don't want to see necessarily a therapist, they do find coaches. They find coaches to help them through their journey, their corporate journey. So I know with physicians who may feel stigmatized, seeing a therapist, talking to a coach may help.
Yes.
So
I think that coaching, first of all, coaching has been scientifically proven to help those what we call lifestyle interventions and improve the yield of lifestyle medicine interventions. So I think the word therapist is kind of has a bad connotation to it. If you think the same, I think you probably kind of get into the same notion that therapist is, it has this mental connotation to it. And maybe, I'm not 100% sure, I cannot speak for every single physician, but maybe they're also concerned about this information being passed on their insurances. Okay. So an insurance becomes an issue, obviously, when the the mental health diagnosis gets into the system.
Okay, that makes a lot of sense. Again, that's the stigma, and then almost like punishing
unacceptable stigma,
Yes,
unacceptable
yes,
stigma, and that
yes.
should change, in my opinion.
Mhm.
And this is something actually we have to be lobbying as a community, as a body of physicians, American Medical Association, lifestyle, American Lifestyle Medicine, College of Lifestyle Medicine. We are already trying to move things, and make sure that it's moving somewhere. This stigma should not be existing.
You've shared some really wonderful information with us today. So before we head out, can you share a book? Can you recommend a book, or can you share some pearls of wisdom with the audience?
I discovered, 6 pillars of lifestyle medicine, and they all address essentially prevention and, changing bits and pieces of one's lifestyle to benefit health in the long run. So what I want to say, people who really are intimidated by all this information, and don't know where to start to change their health and life for better, they have to narrow down one single most important thing for them, whether it's smoking, alcohol consumption, overeating or eating junk food, or maybe too much stress, or maybe they're undersleeping. They have to kind of write down everything they're worried about, right, about their health, and address one most important thing that they think is bothering them the most. And if I had to, if everything comes equal to them, I would bet on one single thing, which is nutrition. Nutrition, food is medicine, and food, whole food, plant-based diet is medicine of all medicines. It actually reverses diabetes, it reverses cardiovascular disease, hypertension, it even reverses depression, arthritis, all kind of inflammatory diseases. And I personally I don't want to promote anything or anybody, but I don't have any
You
affiliation
can
to
tell me
them. But
afterwards.
right, but all of those, plant-based kind of diet books with the recipes, etc., they're sitting by my. I just kind of pull them, and if I need to cook something, so we have our own recipes. So my husband and I like to cook. So, and I like books about sleep, about techniques of appropriate techniques of sleeping, and how to reverse, for instance, jet lag without using medications, without using melatonin, etc. So there are ways of doing that, and mindfulness and mind-body techniques of meditation and mindfulness, and being present, in living in present.
Those are fantastic topics. I wish you would do a podcast on how to reverse jet lag. That would just be amazing.
Okay, I will do that. Yes. Good topic.
That would be
You
amazing.
got it. You
Thank
got
you.
it. Sure.
So I've really enjoyed having you here, Dr. Chamoun. So where can people find you on social media? What are your platforms?
Sure. So my website is www.cardioseeds.com, cardioseds.com. So this is our website with where people can contact me and send an email or contact, and I will answer, and we can start working together, just chat. The first consultation is always free to anybody. So people can find me on Instagram under CardioSeeds, on Facebook, same thing. What else? And on LinkedIn, also CardioSeeds. You will find me there as well. And Dr. Svetlana Chamoun on LinkedIn as well.
All right. So I've enjoyed having you here, listening to your wonderful presentation.
Thank you.
And we'll catch up soon.
Absolutely. Thank you so much for having me, Dr. Onoha.
You're welcome.
Pleasure.
Have a lovely evening.
You too. Thank you.
Bye for now.
Bye-bye.
Bye.